This 55-year-old gentleman was worried about this pink lump on his chin. It had been there slowly growing over 3 years, and he didn't remember a mole being there before that. He catches it when shaving and wanted it removed. It's what I call a PPP, a person with a pink papule problem, because the list of possible diagnoses is very long. Being on the chin, two possibilities stand out. Is this a basal cell cancer, or is it a simple benign intradermal nevus? Sharing it with dermoscopic colleagues, opinions were split. Which side do you join? How will you manage it? Clinically, it was firm to touch, but that's not very helpful because a Meacher type of nevus is firm, being the more common type of mole on the face. Did the dermoscopy sway you one way or the other? The classic blood vessel type in a nodular BCC are called arborizing, branching like a tree. Is that one here? They would usually be well focused, being very superficially located. These are slightly blurry, suggesting a deeper location. On the other hand, if this is an intradermal nevus, a comma vessel is the shape to look for. Are these comma-shaped? The vessels are very variable in diameter, being bead-like, which is a little unusual. What did you make of this pigment here? There's some brown smudged pigment, more typical for an intradermal nevus, perhaps. Note the hairs growing out of it, again swaying us towards an intradermal nevus, but not conclusive. Here's some white circles. Is this related to keratin in the hair follicles? I was in the intradermal nevus camp. The more you look at these, the easier it will be for you to identify them from a nodular basal cell cancer. I was 99% confident in my diagnosis, and in my discussions with the patient, it was irritating him enough for it to be removed. This would be an opportunity to test my diagnosis with some histology, so we opted for a shave excision. I consented the patient carefully, explaining the risk of scarring, in particular a small bald patch, the risk of infection, keloid formation, plus the slight risk of it being a cancer and requiring referral on. I quoted him a recurrence rate of 10 to 20% because there was going to be a dermal element remaining within the skin. Then, as I waited the 3 weeks for the histology result, I became nervous. Was I wrong? Was this really a basal cell cancer? And I'd look like a fool to the patient and my colleagues? Here's the histology report. For you, it was an intradermal nevus. I contacted the patient with the results and he sent me this photograph with a comment. Remember, if in doubt, but when you get it right and the patient is pleased, happy days.